Good afternoon, guys. And I just want to touch on a few of the high points going back to actually more than a year ago. Kind of cover just a couple of things of interest and note that occurred throughout 2020 and the early part of 2021, and then give a brief overview of where we currently are now. So, what is known as COVID 19 now was actually on our radar very early in 2020. January 9th, 2020 was actually the first notification that we sent out to providers in the state of a number of cases of pneumonia that had occurred in the Wuhan, China province. That at the time, the cause was unknown. Um, but fast forward to January 21st, just a couple of weeks later, and the first case by that time had been identified within the United States. And by February, it was at that point that we were calling it COVID 19 or coronavirus disease that was first identified in December of 2019. Um, it was apparent after that first case that was identified in late January in the United States that community spread had been occurring much more widely than was realized. And by late February, it was well documented that community spread had occurred in Washington State, in Oregon, and California. And by March 11th is when the World Health Organization first reported and declared that this was a pandemic. It was coincidentally at that time that Mississippi reported its first case. Um, and by March 19th, we had reported our first death in an individual over the age of 60. So, really, that was the beginning of our first wave in Mississippi that was marked by, at that time, significant impact in our long term care settings, with about 50% of our deaths occurring among long term care residents at that point. As the pandemic progressed by April of 2020, CDC had now recommended universal mask use um, uh, as a preventive measure to prevent transmission. Um, we were also becoming aware at that time of the impact of cases in children. And it was in May of 2020 that Mississippi reported our first case of multi system inflammatory syndrome in children. And so that marked what was being seen nationally and across the world as well, is the significant impact that this can occur in children. By this time, we were starting to see some downward trends in our overall case numbers. But as many of you remember, after the 4th of July in 2020, we began what really was a second wave and far exceeded in case numbers and deaths what we saw with the initial wave in March and April. So that really lasted from July to September. And it was during that time in August of 2020 that we reported our first pediatric death in the state. As many of y'all recall, um, we started to see some downward trends after late August and September going into school, when school was starting, and we saw some decreases in our overall case numbers and deaths. But heading toward the holidays, and by November of 2020, we again saw a big surge that actually lasted through to the end of January, early February of this year. It was during that third wave that we've had so far that we actually saw our peak number of hospitalizations on any given day at over 1,400 hospitalizations reported out. We saw a peak number of cases on January 8th and more than 3,500 cases were reported as actually occurring on that day. That was also when we saw our peak number of deaths, with 57 deaths occurring on one day, January 15th of 2021. It was also during this time that we identified our first variant strain of COVID-19. And as we know now, there have been multiple variant strains that have been identified in various parts of the US and in the world. So where does that leave us where we are now? Well, we are continuing to see downward trends over these last few weeks. We have reported out today 70 cases. That's one of the lowest that we've reported in quite some time, and no deaths. But if you look at our trends, we continue to see some declines in the overall number of cases that are reported and occurring on a daily basis, and the number of deaths. We are also seeing a number of other indicators that are encouraging. We're seeing our syndromic surveillance, which is emergency department visits for individuals with COVID-like illness. Those are on the decline. When we look at our overall hospitalizations and ICU use for COVID-related illnesses and ventilator use for COVID-related illnesses, all of these indicators are on the way down. We are also seeing some improvement in impact on our long-term care setting. And we're actually have less than 50 nursing homes in the state right now with ongoing outbreaks. These are all promising indicators, and they're all good indicators that we are moving in the right direction. So, Dr. Dobbs, I think that brings us to March 2021. I'll let you jump in with the vaccine, or Liz, you direct us.
Yeah, so I'll go ahead and give us an overview of where we are with our vaccination effort. So on December 14th, the first COVID shots were given in the state of Mississippi. And this is the bottle where the first COVID shots were given. And 3 of the people who received those doses are here with me today. Dr. Paul Byers, Mr. Jim Craig, and myself. And we were so excited to have the vaccine because we had been suffering horribly under this pandemic. December 14th was not the culmination of a year's worth of research. It was the culmination of over a decade's worth of research into a new and exciting technology to create vaccines from messenger RNA. We were very fortunate that when the COVID pandemic hit us, that the vaccine makers were ready, set to shift for their messenger RNA technology from flu and other infections and apply it for use with COVID. And for that reason, we have mRNA technology. Keep in mind, a lot of folks are worried that this was done very quickly. In a way, it was done very quickly. You know, we were able to pull together a vaccine and have it produced in really almost a miraculous sort of fashion, but the research behind it goes back many, many years. And the depth of the research as far as the safety and efficacy meets the same standards as other vaccines that we take every day, the flu shot, the pneumonia shot, the shingles vaccine. Really phenomenal, exciting developments. If we think about this vaccine, then we also know we were fortunate to have shortly thereafter the Moderna vaccine. And now, a week ago, we were able to get a hold of the Johnson & Johnson vaccine. And just last week, we were able to immunize, get over 130,000 shots in Mississippians to fight COVID. Now, the immunization effort hasn't been easy. We're not far into it, keep in mind, but it has not been easy, especially when we think about underserved populations, populations that might have good reason for historic mistrust of the government and the healthcare system. And so early on, we recognized that we were struggling with populations that were disproportionately affected by COVID early on, as far as deaths and hospitalizations, primarily the African American community. Early on, Black Mississippians were accounting for about 15% of the vaccine utilized in Mississippi, while accounting for 38% of the population. But just this last week, we saw an increase to 30% of the vaccine going to Black Mississippians. And our average overall has increased to 25%. So I do want to thank our partners. I'd like to thank leaders in the Black community, Black ministers, leaders, physicians, nurses, who've really done a great job, State Medical Association, for making sure that there's an understanding of how important this vaccine is. And it's also something that we need to do is get more access for everybody, not just if you're African American, or if you're Vietnamese, or if you're Hispanic, or if you live in a rural area. So we're really proud of the work that we've done with our vaccination, but we have a long way to go. We're not done with the COVID pandemic. COVID is real, and we're really winning, right? But just like in a baseball game, just if you're up a run or two in the 6th or 7th inning, you don't just lay down and let the other team just go at it on offense. It's time to continue with some of the safety measures we have in place. Continue to mask in public, continue to avoid indoor social gatherings, and get vaccinated when it's your turn. Now, fortunately, we're seeing some light at the end of the tunnel. CDC released new guidance today that says if you are going to do something with other people who are vaccinated, you can do social events or be around other folks without a mask if you're all vaccinated. Fantastic developments. We got a lot of optimism on the horizon, but we also have challenges. We have viral variants. We have variants that are more contagious, and maybe some that are going to make the vaccine less effective. I just want to reiterate how important it is to do these approaches in tandem, vaccination and prevention. Although there is not a statewide mandate right now, or really, most of those are going to be local as they exist. All over the state, I've seen over the past week, people continue to show prudent behavior by wearing masks in public. And I just want us to keep that up. I'm proud of Mississippi. I'm proud of what we're doing. Let's keep our foot on the accelerator, pushing COVID down so that we can get back to full normal before too long. And that's all that I have. And I'll kick it back to you, Liz.
Thank you so much. And Dr. Dobbs, I didn't hear you mention this, but one of our other great partners working with the African American communities has been the historically Black colleges and universities. So a big thank you to them as well. Jim Craig, can you go ahead, please?
Sure, thank you. And I appreciate the opportunity to share just a little bit of the history of where we've come from last year to now on our testing front, and also in our vaccination efforts, especially in our drive-through operations. So just a short time ago, March 3rd, 2020, is when we stood up the Health Department's Emergency Operations Center and began formalized response to the COVID pandemic. A few weeks later, March 16th, Governor Reeves activated the Mississippi National Guard, and they have been a wonderful partner in both our testing mission and in our vaccination mission through the drive-through locations. March 20th, community testing began throughout the state, including a lot of our county health departments, normal referral places for testing. And while every health department is not open every day of the week, we tried to work to make sure that testing was available in every county at least once to twice a week, to fill those holes that might exist between private providers that were out there providing COVID testing. March 24th was a great date for testing when we opened the Mississippi Fairgrounds. And you might remember that we had a testing location out there for quite some time that was supported by our other great partner at the University of Mississippi Medical Center. In June 3rd, we transitioned away from the fairgrounds and moved over to the Capital City Testing Center at the Farmers Market, where it's still providing testing for the Capital City area today, and operates Monday through Saturday. On December 30th, if we look for what happened since the beginning of our operations through that first year, our cumulative number of testing site days where we actually tested somewhere, was 2,750. And the Capital City location at that point, at the end of December, had tested 34,481 individuals. Total testing in the state of Mississippi by December 30th was 1.7, just a little over 1.7 million Mississippians that had been tested. March 7th, 2021, we jump ahead to where are we at now compared to last year. Instead of 2,750 cumulative testing days, we're now at 3,360. Our capital city site has now tested 52,637 individuals, and our total testing as of the 28th of February statewide is 2,472,673 specimens processed. So that testing effort, and again, in combination with the University of Mississippi Medical Center, the Mississippi National Guard, MEMA, lots of folks and some great teams at the health department, especially our local health departments being part of that process, has made it a very successful event for providing testing in Mississippi. We transitioned a lot of that infrastructure in the beginning as vaccination talks were coming to roll from not only providing testing, but to also providing vaccination in our county health departments. And there were specific county health departments that were set up, a couple in each one of the regions. So we'd have some regional distribution of where the very, very limited amount of vaccine in the very beginning could be made available. But we knew that there would be growing numbers of vaccine coming to the state. And to make sure that we were prepared for that, we started recruiting sites that would be larger, closer to well-traveled highways, closer to our population centers, that could begin providing a vaccine in greater numbers. So we started vaccinating January the 4th, 2021 in our drive-throughs. And we began that transition to many of the sites that we have now. As you know, we operate 19 sites around the state as state operated sites. And I'll just share a quick graphic to show where those sites are. In case can y'all see that? So this is the 19 sites of where we're located, 2 in each of the public health districts, and there are 3 in the central part of the state. In addition, we have some county partners, local county governments, emergency managers, in some cases hospitals, school nursing programs from some of the colleges, a lot of people part of this process and these teams bringing vaccination to different parts in the drive-through settings. So these are county sites that are serviced through state appointments. Coahoma County at their Coliseum started last week. Bolivar County started the week before. Warren County has been with us for a while. Sharkey-Essequina started last week at the Old Armory. Lawrence County has been with us for a little while. And starting next week, or 2 weeks, I'm sorry, is Claiborne County. And Alcorn University will be, and their nursing program will be supporting that. As you notice, where a lot of the county locations we've tried to emphasize are in the Mississippi Delta. So as we, again, try to work to make sure to address the health equity issues, we want to make sure vaccines available as much as possible in these particular areas. So let me stop the share for a minute. And Liz, that's kind of a short update on where we've come from testing and vaccination.